so I feel like I need to rub my stomach and pat my head so I can do this at the same time. If I run into problems and I get behind on slides, somebody can wave at me. Thank you for having me here. It's good to be back at the Digital Health Forum, or Digital Health Summit. First, I want to wish all of you a Happy New Year. 2017 is a very important year for Omron Healthcare. We are evolving our mission. We're now looking at how we can do more with the 40 years of experience we have in making blood pressure monitors by taking our mission to a bigger and bolder level, and we're calling it Going for Zero. Zero heart attacks, zero strokes. We want to eliminate heart attack and strokes. It's big, it's bold, and we know it's necessary, and we feel that we have some good information, some good knowledge that can help make that happen. So look, heart attacks and strokes have impacted almost every one of us. If you think about just the last 4 weeks, there's been several celebrity deaths from cardiac disease. And I don't even have to name the names. You guys know them, you saw them, and we all wish it hadn't happened. Now this is for everybody in the room. Raise your hand if you know someone who's died of a heart attack or a stroke. Now keep your hands up. Now raise your hand or your other hand if you know someone who has had a heart attack or stroke but lived. Now look around the room. Almost every hand is raised in the room. You can put your hands down now. Thank you. I wish it were a surprise, but it's not. 750,000 people, this way, 750,000 people in the US have a heart attack each year. That's about 4 times the attendance of the CES meeting. About once every 40 seconds, someone in the United States has a stroke. That's 15 people in the time that I'll be standing up here presenting to you today. And heart disease is the leading cause of death in the United States, actually in the world. The statistics say that for each of you and the 2 people sitting next to you, one of you will die from a cardiac event. Yeah, it's him, not you, right? Okay. That represents a profound public health concern. As we've seen, it's a very personal issue for all of you. At Omron, we create advanced blood pressure monitors, medical devices that meet FDA standards so that patients can monitor their blood pressure at home. About 80 million people in the United States are hypertensive, and you may know many of these people. So if you're one of those 80 million, or you know one of them, it's very important that they know what their blood pressure is. Not just their steps, not just their heart rate, but they need to know what their blood pressure is. And they need to know it accurately. They need to know it's not an estimate, it's not a guess. It's really something that matters to them. We've been creating blood pressure monitors since the 1970s, and we've been evolving the technology. As you can see, from where we were back in 1970 to where we are today, over time it's taken us to do this. We've gone quite a ways. And for us, the key is they have to be clinically accurate, FDA cleared, easy to use, portable, and connected. Going for zero heart attacks and strokes means we have to do more and dig deeper into our knowledge and our R&D. Most people are familiar with using a blood pressure monitor, either from their doctor's office, where someone in a white coat puts it on you, or maybe you go to your pharmacy and put your arm into the unit. We know that we now need to make it more mobile, more easy to use, more connected, and yes, even more attractive to own. So we're debuting some new technology here at the CES meeting, and we think it represents one of our investments into the Going for Zero mission. When people think of monitoring your blood pressure, we don't want them to think of what we saw just a minute ago with the doctor or with the pharmacy item. We want them to think of something neat, cool, something that they can wear, something that they can take with them to work, put in their backpack, their purse, so that they can take a measurement anytime they need to. And imagine the difference it will make when someone could get a clinically accurate blood pressure monitor, and it could be as simple as pushing a button on a watch. And this is not my smartwatch. This is my blood pressure monitor. And I won't tell you what my reading is now because it won't be good. That's the kind of technology we're showcasing here. Not only are we trying to make it easier for people to know their heart numbers and to use a blood pressure monitor, we're also very excited that we can help them connect their blood pressure monitor and that help them to share the data if they choose. The studies have shown that people that connect their units and have data being managed are more likely to continue to use their blood pressure monitors. Our new devices integrate with our mobile apps. They allow people to access their information from a smartphone or a tablet. They allow them to share it with their doctor, with a loved one. They can share it with another app. It gives them very many options to do things that they might normally not do with their blood pressure information. We know that people that use their blood pressure monitors and connect them are more likely to use that information and do more with it. The data that is supplied can help your doctor give you better diagnosis, help your doctor to change your medication in the correct way, and hopefully deliver lasting, impactful behavior changes. But there's more than going for zero than new technology. Going for zero will require a cooperation and collaboration with governments, schools, media, healthcare providers, senior citizens to educate everybody on heart-healthy behaviors. And they will include the use of advanced technologies, but it'll also include more. We're taking that forward right now with key partners, so we can't do it by ourselves. These partners help us, or also believe that it is possible to achieve zero heart attacks and zero strokes. We're collaborating with companies like AliveCor, a Silicon Valley company that has a great digital health platform. We've collaborated with the team at Lark, who has an app similar to what you saw a few minutes ago for diabetes patients. We're also working with organizations such as HealthCore, which helps educate teenagers on what's the right food to eat and how to have heart-healthy habits. And we continue to work with organizations like the American Heart Association to get heart-healthy information and equipment into the hands of at-risk communities. We're launching a national campaign to educate that involves social media, news media interviews, speaking at engagements like this, and making more connections. Look, we want to help save lives. I'm here with some very tech-savvy people in this room, and we know that we must change behavior to accomplish the Going for Zero mission, and we know that means getting you involved. So we've opened our API. We invite developers and organizations and companies to collaborate with us to use that data, collect it, and gather it to do more than just read blood pressure readings. If you visit our company website, you can find information on how to begin collaborating with us. We've also launched a website on Going for Zero. On this website, we have tips, tools. We're adding news and assets every day. There's also a pledge for you to take that you want to pledge that you will take care of your heart. And we've been very excited in just a few days of launching it. We've had lots of people join and take the pledge. Finally, I said I want your feedback, and I mean it. You can reach us and you can reach me at www.goingforzero.com. Please take a photo of the slide. You can contact me with your thoughts, and you can come talk to us if you want, because we're downstairs in Tech West at booth 43821. I'm pleased to be able to share this mission with you. It's very exciting for us. And I just want to do one more thing. I want to ask you all to take care of your heart. Thank you.